Recently, both the American College of Obstetricians and Gynecologists, aka ACOG, and the American Academy of Pediatrics, aka AAP, released recommendations for the COVID-19 vaccines, and they don't really line up with what the branch of Health and Human Services, HHS, CDC's Advisory Committee on Immunization Practices, aka ACIP, has been saying. Whew, that's a lot of acronyms. Look, for the TLDR on some of the places that these organizations have been split from ACIP, here is the gist. First, ACOG says all pregnant people should get the updated COVID shot no matter what trimester they're in, based upon credible evidence that it is safe and effective for people who are pregnant and their babies. According to a statement from ACOG, they recommend an updated COVID shot in, quote, individuals contemplating pregnancy and in pregnant, recently pregnant, and lactating individuals. This statement is in stark contrast to what the recent HHS announcement was, saying that COVID-19 vaccines will no longer be recommended for vaccines for pregnant women. Next, given available credible data and evidence to safely protect tiny humans who are the most vulnerable, AAP is strongly recommending COVID-19 shots for children aged from 6 months to 2 years. Additionally, they recommend shots for older kids as long as their parents want them vaccinated. For a reference of how monumental this is the first time in 30 years that the AAP has seriously diverged from the US government vaccine recommendations, and for most of those years, the ACIP has based their recommendations on AAPs. The HHS recommendations for reference are that healthy kids do not need to receive the COVID-19 shot, but they say that they can in consultation with a healthcare clinician, which includes their pediatrician or pharmacist. Now, you may be thinking between the brain fog of all those acronyms that this sounds confusing and hard to follow, and frankly it is. If you're worried about which guidelines to stick with, the HHS Secretary's statement does not change science-based recommendations to provide vaccinations to different age groups, and APHA recommends pharmacists continue administering vaccines under their state-based authority. APHA is also consulting with our partner Healthcare Providers Service Organization, which offers professional liability insurance specifically designed for pharmacists with coverage against malpractice claims and other professional risks. For pharmacists and other clinicians out there, continue to administer vaccines under your state-based authority in alignment with scientifically based recommendations to assure liability protections.